Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I'm so glad you joined us tonight. If you're one of our regulars, you know how it goes. We love this show so much because everybody learns something every week, and it's live. We're here in the studio right now. That is why the phone number is up at the bottom of the screen. We have a guest with us tonight. This show is going to be so amazing. They are all amazing, but tonight I'm really excited. We're doing a show about acupuncture, and actually we have an acupuncturist with us, a doctor who's an acupuncturist. She's going to demonstrate it on herself. I did not volunteer to do it. She said she would do it to herself. But if you have any questions about that, she has some really fascinating information to pass along. Please call us at any time as I'm conversing with the doctor. We would love to hear from you. So we'll keep that phone number up at the bottom of the screen. It's 969-2720. If you're outside of Fort Wayne, just put an 866 in front of there and it won't cost you a penny to call. You have two options when you call in. The first one's my favorite. I like it if you ask the question live, if you feel brave enough to do so. We don't just throw you on the air. You call in, you talk to a very friendly call screener, and then we will connect you so that you can ask the doctor your question. That's really nice because maybe the doctor needs more information from you to give you a better answer. But I totally understand if you would prefer not to do it that way. So when you talk to the call screener, you can also just relay your question to her and she will give it to us. And one way or the other, we'll get an answer for you. So just wanted to throw that out there. The show goes quickly. I would call sooner rather than later if you have a question. So without further ado, we'll go ahead and introduce you to tonight's guest. So she is brand new on our show. This is Dr. Lauren Warner, and you are an acupuncturist.
Yes, thank you for having me.
Oh, pleasure to have you. I've been doing this show since 2008, and I don't recall, now there's another gentleman who hosts, Mark Evans, but I don't recall ever doing a show on acupuncture.
Yes,
so
I'm excited to talk about it.
I think, I was telling you before the show, I don't really like needles. I think most people probably don't. And years ago, I was writing for a magazine, and they assigned me to go talk to an acupuncture, a doctor who was an acupuncturist. And he was just all about it, but really, I left kind of scared. I really did. It did not calm me down at all. It was interesting. But just talking to you tonight, I thought, oh my gosh, it's really come a long way in all these, because that was what, 18 years ago. So.
But even then, and feel free to cut me off if we need to take a caller, because I'll talk about acupuncture all night long.
Yeah, I know.
I can go. But no, I think a lot of people get scared of acupuncture and they don't want to come in because they think we use like big, giant hypodermic needles that you get your blood drawn with, or an IV. These are really small. They're hair-like. I mean, they're four times small. They're so small. They're 4 times smaller than a sewing needle. They're stainless steel. They get used once. They get thrown away and disposed of. And they honestly don't even really feel them when they go in. Some might give you a little hello, and I'll kind of demonstrate that later. But it's honestly a very safe, effective technique. I usually fall asleep on the table every time I get it done.
That's just it. I was doing a little research, and it was like, the Western culture doesn't really embrace it so much. Even, our medicine is only, a couple hundred years old. And this is based on, things that are have been around for thousands of practices for thousands of years.
It's so interesting. So it originated 3,000 years ago in China. But really in the United States, it's just been in the last 50 years. So in 1969, you had your first acupuncture class ever taught, which was in California. In 1975, California was the first state to license it as a profession. But what really kind of sparked the interest was a journalist in President Nixon's press corps, went to China with him in 1971. And while he was over there, the journalist had an acute appendicitis. So he had to have surgery over there. And he had so much post-op pain that the Chinese doctors there used acupuncture on him bedside to just kind of calm down his pain levels, the inflammation. And he was so blown away by the response, he came back and wrote an article about it that was in the New York Times. And that was really the first time anything had ever been published in the media from like a firsthand experience.
Well, it looks scary because it's not natural to to think about putting needles in all over in your skin. But you brought a model and everything with. I mean, it's hard to imagine it being relaxing, but you say that you fall asleep.
Oh, I fall asleep. A lot of patients in general will just say they can't believe how relaxed they are having needles in them. And it's true, but it's a very relaxing environment. I'm going to demonstrate it in a little bit, and you'll see how tiny they are. We're not going deep. It's fairly superficial right into the skin.
Is that how it all is for acupuncture, or are there different kinds?
Yeah, there are different kinds. First is there's kind of a spectrum on the types of treatment. There's individual private sessions where you're in a treatment room by yourself.
Yeah.
And it's usually full body. They'll do a front treatment, a back treatment. You're there for about an hour. Then you have community acupuncture where you could be sitting in a room in a chair in zero gravity chairs with 5 to 10 other people, just getting superficial like lower extremity, upper extremity points.
Kind of like at a beauty salon or whatever. Okay,
totally.
yeah. Okay.
Or then there's things like battlefield acupuncture where I could just treat somebody right here just putting needles in your ear. So there is varying degrees of treatment, but what I do like to explain to people is that there is, the traditional Chinese medicine, been around for thousands of years. So I like to explain the Eastern perspective, but also just like the Western perspective now that we have modern anatomy and MRIs and EKGs, we can kind of explain how it's working and what it's doing. So the Eastern theory was very much based on, hey, you've got these channels running up and down your body, and that's where they would say your blood would flow or your chi, your energy would flow. And back then they would say anything that blocked that flow, whether it was a physical trauma, stress, or an illness, would kind of cause stagnation of that flow. And that stagnation would result in a physical or emotional symptom. So if someone came in with shoulder pain, they would say something's blocked here. And they would tap points in along these channels to kind of open up that flow. Well, fast forward all these years, now we have this technology and we can kind of measure things and do scientific studies. It's like you do have these channels. It's your nervous system and your vasculature, the connective tissue is a huge part of it. So I always say the physiology is very similar. Like if I were to take a little knife and kind of cut myself, I don't have to sit there and go, make a scab, make a scab. Like your body just knows, hey, something injured the skin, get blood there, heal the wound. So essentially when you're on the table, we're just tapping in these little micro injuries. So as you lay on the table, you get a really nice increase in blood flow, which is anytime you're moving blood, you're moving oxygen, nutrients, carrying out lactic acid. So it's a really nice anti-inflammatory treatment. And then acupuncturists love working on muscle tension. It's very effective. But one of the best parts, in my opinion, is how it is so effective for chronic pain. Because when the needles tap in, your brain thinks, hey, something pierced her skin, she must be in pain, and it kind of tricks itself into releasing endorphins. So you just get this nice kind of happy chemical buzz, and that's what calms down stress levels, cortisol levels, and just kind of dials your pain signal down. So that's kind of the Eastern and Western way to look at it.
Yeah, it's, and I know there's been a lot of breakthrough medications, but and I have 2 children who have chronic illnesses, and I'm always kind of keeping my eyes open for, is there a more natural way that they can manage it? It's Crohn's disease; they'll have it their whole life. There's no cure. And so I'm always looking into it because I just sit there when they're getting their infusions, and I think, I kind of feel like they're putting poison. I mean, there are side effects. Every drug has a side effect. So I don't know. Like as acupuncture, I was told doesn't really have any side effects except positive things.
Yeah, sure. No, there's always that. You could get a little bruise, just a tiny drop of bleeding, maybe a little muscle soreness, but acupuncture, while the World Health Organization recognizes it for treating over 40 different conditions, but then there's a whole other list that it's recognized for being a really great complementary treatment. It goes very well with medication, post-op procedures, fertility when women are getting IVF or IUI. So there is a way to really integrate it with Western medicine. It can be, I wouldn't say it makes the medication more effective, but if the acupuncture can be used to make the patient sleep a little better, have a little less inflammation, it just works as a whole with all these other things like the surgery or the pharmaceutical. So it does go really well with Western medicine, but it can be used for certain things by itself.
It's amazing. It seems like there are endless possibilities.
There's a lot of conditions. It's been around for so long, so you can Google almost any condition with acupuncture
and find it.
But there are certain ones that are more effective than others.
Well, we did have a question from somebody. Let's see. I guess they wanted me to ask the question for them. So it was Doris. She says she has myopathy, and she's wondering if acupuncture would be helpful for that.
It can be really good with myopathy, which is a muscle type of pain, muscle fatigue. We always, when the patient comes in, we would talk to her about other, comorbidities, what other conditions she might have, where the myopathy is coming from. We'd look at her nutrition a little bit, work with her medical doctor too to see what she's taking supplement-wise. But the acupuncture can be really nice for temporary pain relief. It can last longer depending on the condition, depending on how long she's had the myopathy, how severe it is. The results may vary, but it would definitely be worth trying. Normally we'll say, let's give it 4 or 5 visits over the first few weeks, and then we reassess and see how you're doing. If we're not noticing progress, we'll tweak it a little bit and try a different protocol. But myopathy would be a condition that acupuncturists would like having come into their office.
Yeah.
And if we don't think we can help you, we will definitely send you to the provider that can.
That could do it. Yeah. Well, there's just, I think in general, you just, I see all these ads and commercials for things just to relieve achy joints and just things that I can tell you from experience. When you get old, you start something different hurts like every day. Yeah. It's like, oh, why? And it's not from doing something cool like skydiving. It's just from living. And I know it can be debilitating, and then that gets into, I think, a mental issue as well, just kind of depressing that you don't feel well.
Yeah.
So, I don't know if it is acupuncture, something people could turn to just for normal, wear and tear, I guess.
Oh my gosh, yeah, it's great for osteoarthritis, neck stiffness, low back pain. But you even touched on how chronic pain will sometimes start to cause an emotional effect, like depression. They go hand in hand. Depression's one of those conditions. Acupuncture is a great complementary treatment, with the primary treatment being medication and counseling. Yeah. But the acupuncture really can help control some of the hormones and neurotransmitters and just help kind of give a calming anti-inflammatory to them. But yeah, it's an amazing treatment for muscle aches, stiffness, tension. Headaches are probably some of the favorite things to treat.
I think a lot of people have that.
Oh, we all do. Yeah. I mean, we live in a world, we kind of wear our shoulders up like earrings, we keep our chin jutted forward, and we're at the computer for a long time. And so you'll get that tension that comes to the base of your skull and just kind of wraps around. That's probably one of my favorite conditions to treat. A lot of acupuncturists treat that.
Oh, that's good to know. So we have a couple calls I wanted to get to, but before we do, I wanted to ask you, I forgot to ask you about children. Like, are children accept, can they do this, or?
Yeah, and this, will vary by practitioner. So I always say call the office and see, talk to the practitioner or their front desk staff, see the ages that they'll treat. Sometimes it's 16 and up. You can do acupuncture on any age, but sometimes with little kids, they're not big fans of needles.
Yeah, they're not really going to relax. Still, right? Like a toddler's not going to sit still, so that probably wouldn't work.
Yeah, we'll recommend acupressure, which instead of inserting the needle, it's just using a light, steady pressure, about what you would press on a tomato when you're checking it. Yeah. And you can kind of activate the mechanoreceptors there and the acupuncture point. So acupressure is a really good one. Some practitioners will do laser acupuncture. You don't feel the laser. It's a different kind. It's very superficial, but they'll do that to activate the point on kids. So that's a good alternative.
All right. That's good to know. Yeah. So let me go ahead and let's see. There's, actually, Jody. Thank you, Jody. She was willing to ask her question live. Jody, are you still there?
I sure am.
Oh, thank you so much for calling. Go ahead with your question.
My question is, if there is a patient who's in like a post-op recovery time and they want to add acupuncture to part of the treatment options, is there a window of time where it's not appropriate, or is it something that you could use as part of your post-op recovery in enhancing like healing and faster recovery?
Sure, for sure. It can be great during post-op. But in general, I usually say wait 4 to 6 weeks post-op, just because you want to have your follow-up with your surgeon, you want to get cleared, we want to make sure the incision is healing okay. So generally, I recommend 4 to 6 weeks. Now, there are some different things. For example, if somebody has a hip replacement, I don't necessarily want to put them in a prone, which is face-down position. So we might wait 6 weeks for them. If a woman has had a hysterectomy or a laparoscopy, we'll wait about 2 months before putting them face down on the treatment. So 4 to 6 weeks is a safe bet, and always just mention it to your surgeon or primary care physician to make sure they're okay with it. But we would never do any needling around the incision before that time. Yeah.
Jody,
that's helpful. Thank you.
Yeah,
okay.
Totally.
I didn't know if you had anything else you wanted to ask. So
thank you for calling.
Thank you, Jody.
Yeah, no problem.
Thanks. Also wanted to take a question from a woman named, it was Michelle, and so she wanted me to ask for her.
Oh, okay.
She wanted to know about blood thinners. Like, are there risks, or can you do acupuncture if you're on blood thinners? Yeah,
you can definitely do acupuncture on blood thinners. However, it varies. A baby aspirin is pretty benign, that's fine. Yeah. But if they're on a higher dose, if they've had a stroke, they're on higher doses of Eliquis or another blood thinner, we would modify the protocol. You're not going to do any scalp points. Certain points would be eliminated. The needling depth would be changed. I will say, if you have just had a stroke, and this is just an example, and you get on a high-dose blood thinner, I would give it a few weeks. If you're still going in to get your, what's called an INR, like your blood ratio checked every week, I would hold off on the acupuncture until your body's adjusted to it for a few weeks. And again, always checking with your doctor is a good idea. But yeah, the acupuncturist will modify the protocol and the points for blood thinners.
And I'm sure, you know, we always tell people don't do anything drastic without checking with your family doctor.
Totally,
But I mean, I'm assuming you probably have had many conversations with physicians acting as that in between. You know?
And if the patient comes in, you know, to any office, practitioners are happy to let them know, like, look, you need to wait a few weeks, or let's talk to your doctor first just to make sure they're on board with it.
No.
Thank you for calling in.
No, I appreciate that. So the phone lines are empty now. We've cleared them out, but we've had 3 great calls. Great questions. We welcome more. So again, there's that phone number at the bottom of the screen. It's 969-2720. Makes it a toll-free call if you put 866 in front of there in case you're outside of Fort Wayne. We only have Dr. Warner here for a little bit longer, like another 10 minutes, I think. So I know I told her the show goes very quickly. So please call sooner rather than later. We'd hate to miss your questions. So. I think some people, you know, might be a little overwhelmed at the thought of because you know it reminds me of when I first got contacts when I was still in high school, and I remember the woman saying I couldn't do it, and she said because it's just not natural. She's like, it's not natural for us to want to put our finger all the way like up to your eye. So she was trying to, you know, get me to calm down about it, and I guess I kind of think about acupuncture the same way, like. I look at a needle and I think, I don't, you know, maybe like a quick shot, but the thought of like laying down or sitting down and just being calm and having those. So
people are truly shocked at how relaxing it is. If you don't care, I'll go ahead and do a little demonstration.
I'd love to see the demonstration. Yes, please.
So, like I said, normally if we're doing it, we'll talk about individual kind of private sessions. Some practitioners might put you in a gown or in shorts. You'll get on a massage table. So let's say we're going to do a face down treatment. I always tell people the needles I mentioned, stainless steel, sterile, they get used once and they get thrown away and disposed of. Years ago, I think in the 70s and 80s, they used to sterilize them and reuse them.
Oh, gosh.
Nobody does that anymore. You definitely want sterile, single-use needles. But you can see how tiny they are. Now, when I pull them out, these is about a 1/2 inch. Let me see if you can, I don't know if there's a, I don't know if you can see. Oh, there, you can probably see it on my shirt a little better.
Trying to get,
it's very, and that's the handle you're really seeing. The actual tip of it is very, very thin. And so I always show that to patients just to alleviate any concerns about how wide
it looks like a hair.
I know,
really
it's very tiny. Like I said, 4 times smaller than a sewing needle. But what I tell patients is once you're comfortable on the table, the area is cleaned with an alcohol swab. And then I take the guide tube, and just so my patients know what it feels like, I'll say, this is the guide tube. That's just what the plastic feels like, right? So I want them to be used to it. And then once the needle is loaded, you'll still just feel the tube, but when I'm ready to insert it, you just feel me drop it, and then it taps in just like that. So,
and how long do you leave that in?
It depends. It'll vary on the condition, the patient's age, what we're treating. But once they're in, people, you know, get worried. They don't have to be stiff. You can move a little with them in. I don't want you to get up and walk around the room or anything, but you can relax. You know, if you have them on your stomach, obviously don't bring your arms up. But you can see it's very comfortable. Now that one, I didn't even feel. Some, when they tap in, you might feel a quick little pinch. I say give it about 10 seconds. Let me know if it doesn't calm down, or let your practitioner know if it doesn't calm down. Now, there's certain things you can do with the needle. I like to come back to it and just tap it. I'm not going to press it in deep. We're just kind of tapping the needle because that creates a vibration. And the vibration is what your skin receptors pick up on and signal your brain, like, hey, something's going on, get the blood moving, the connective tissue responds to it. Now, once they're in Chinese medicine, they call it the dachi. They want you to feel that stuck energy moving. So I'll have patients, some feel really heavy, some feel like they're floating. I usually fall asleep, take a little nap. We say there's no better nap than an acupuncture nap. But once they're in, now on certain conditions like chronic low back pain or peripheral neuropathy, we will actually clip a TENS unit to it, and that will give a little extra stimulation versus me manually tapping it. But we do want you to feel sometimes a little pressure, warmth, tingling. That's all totally normal. A dull ache is even a beneficial sign that we want to see. We just don't want anything sharp or uncomfortable. And then normally, let's say we're doing a full body treatment, you'll relax on the table for about 20 minutes. When the needles come out,
you just take them out?
Yeah, sometimes you might get a little drop of blood. Occasionally, I gave myself a bruise the other day, but other than that, it might itch a little. But once they come out, everything's thrown away.
Yeah.
Sorry, I've got my little sharps container down there.
a whole
Everything's thrown
kit.
away
She
and
brought a whole-
disposed
the whole
of. Whole
thing,
kit.
yeah.
But yeah, so a lot of times we might do a face down treatment. The needles will be in for 20 minutes. We take everything out. In addition to acupuncture, you might get some gua sha, which is a scraping technique. You might get some cupping, or some practitioners will utilize moxibustion, which is like a warming Chinese herb that's used to warm certain points. And then
Like you just would rub that on the skin? Or,
it depends. Moxibustion's used by certain practitioners. They might have them in cones or on sticks or in little devices that you actually set on the skin where it burns. So it's just the heat coming from it. It's not in direct contact. But yeah, so normally it's maybe 20 or 25 minutes on each side. They might do a hot pack. I mean, so it's usually about an hour, but that depends on the condition and the patient.
Sure.
But it's very comfortable. You can expect anywhere from 5 to 25 needles on each side at separate times, obviously. But yeah, I mean, it'll vary by practitioner, but.
And go to somebody who knows what they're doing. Like, don't go to, hey, my best friend's sister used to do this, and she'll do it for free. You know? This is not like, you know, sometimes I would have friends going through massage school. This is actually, I'm laughing because Roz behind the camera, she is a massage therapist, but I had friends that would be like just wanting to do it on the side.
Sure.
And you know, it's not that. It's not, it's to be taken seriously.
Yeah, I will tell anybody, no matter where you live, and they just changed their name. It used to be the nccaom.org, and that was the website you could go to find a practitioner that was a master's or doctoral level degree in acupuncture. They just, as of January 1st this year, changed their name and modernized it a little bit to the National Certification Board for Acupuncture and Herbal Medicine.
Okay.
But that website is still the same. I just checked it this morning. It's still nccaom.org. Go to find a practitioner, and like I said, those are the practitioners who have their master's degree or doctoral degree in acupuncture. And I'm always a fan of saying, call the office, talk to them, because usually practitioners, if it's not a condition they specialize in, they are happy to refer you to another practitioner or colleague.
Okay, there's that web address.
For sure.
So, thank
perfect.
you.
Thank you for doing that.
Yeah, that's great.
Yeah.
Well, and that, because it is kind of a newer thing, you know, and there, you know, you may have a physician who's hesitant to it, so you may have to, you know, explore it on your own and make sure it's the right thing for you, I guess, you know. So do you find that, you know, somebody, like, I was intrigued by the chronic illness issue, like something like I was mentioning, my sons have Crohn's disease.
Oh, sure.
So, or you know, whatever the disease may be, are there people, is it okay to do acupuncture like your whole life?
Oh, absolutely.
Or like, I didn't know if there's limits, like you shouldn't do it, you know, more than so many times per year or something.
You can definitely do it for years. I will say the limitations come more on how often you're doing it. I wouldn't say for particular conditions, for a regular person just looking for relaxation or tension headaches, you don't need it daily. You don't want the needles in for extended periods of time because it can be really fatiguing.
Oh, sure.
So yeah, protocols are definitely adjusted. Now I will say, somebody sprains their ankle and they have a little swelling, that's probably 2 visits, maybe 3.
Okay.
Somebody who's had bilateral knee pain for 20 years, you're expecting probably 8 to 10 visits off the bat just to kind of see how you're doing with it because of how long you've had the condition.
Right.
But yeah, no, acupuncture can be used throughout the life. It's just how long the needles are in and how often you're having the treatment. Yeah.
Well, there was. We just have a couple of minutes left. I just want to quickly ask you because I know I have heard of this dry needling.
Oh, sure.
And I feel like, you know, there's always
so
some
confusing.
latest and greatest. So is that different than acupuncture?
Yeah, it's kind of a hot question because with acupuncture, I will say they use the exact same kind of needle. It just depends on the practitioner doing it. So with acupuncturists, if you go to see an acupuncturist, let's say for shoulder pain. We might do some trigger point acupuncture, which is a little bit deeper to release what we call ashi or trigger points. It's been around for thousands of years, this ashi acupuncture, trigger point acupuncture. But in addition to the shoulder, we're also going to ask about your sleep and your stress and your digestion, and you're going to get points other places besides your shoulder. So that's kind of that difference. Acupuncture still takes into account the whole body in the traditional Chinese medicine. You go to dry needling, the easiest way to describe that, those are Western practitioners who use an acupuncture needle to release trigger points, relieve myofascial pain. It can be very effective. It's just a hyper-focused use of an acupuncture needle. It's very much based on just the Western medicine, but acupuncture also addresses musculoskeletal issues. I think both are very effective. I just always recommend, again, calling the practitioner, talking to them about their training, how often they've done it, what they had to do to get their certification in it. You want to make sure that they do it frequently enough to be an expert at it.
Sure.
Because with dry needling or trigger point acupuncture for that matter, you are going a little deeper. You're not just going into the connective tissue, you're usually going down to the muscle to create a little jerk reflex to get that muscle to relax. So again, I know dry needling practitioners who are amazing, and I know amazing acupuncturists. It's just finding the right person and seeing what they do.
I was going to say, sometimes don't jump on the bandwagon until you really, because there's always these trends in well-being, so you want to make sure you're making good choices.
For sure, for sure.
Sadly, we have like 15 seconds left.
Oh my gosh, that's so crazy how quick it went.
It was. Well, you're a wonderful guest. We'll have to have you come back.
Thank you. It was so nice talking to you, for sure.
Thank you. Same here. Thank you for the demonstration. I think hopefully, maybe you want to think about it. It's kind of might be a new thing to you, but definitely interesting. So, Dr. Lauren Warner, thank you
for
so
having
much.
me.
Come back, and I hope you will join us next week. 1 week from tonight, we'll have another HealthLine for you. I'm Jennifer Blomquist. Take care. Have a good night.
PBS Fort Wayne was made possible in part by...
You gotta find your people.
Good morning.
The ones that make you feel whole.
Good. How you feeling?
You look so pretty today.
When you're together, you got nothing to lose.
Good job.
In a world full of strangers, you don't know who to trust. You can't go it alone. Everybody needs help.
Go.
You gotta find your people, then you'll find yourself.